With high burden of cholera, accounting for over 4,000 deaths in about 3 to 4 years and over 140,000 suspected cases, the need for increased awareness and improved hygiene among citizens has been emphasized. This was made known during a media roundtable at School of Nursing, Mall Road in Calabar. The report.
Statistically, Africa accounts for 90% of global cholera morbidity and mortality rate, and Nigeria, which is one of the endemic nations, recorded over 4,809 suspected cases and 156 deaths in 2024. In a media roundtable to educate journalists on the burden of cholera, its risk factors, treatment, and preventive measures, Director Cochrane, Nigeria, Institute of Tropical Disease Research and Prevention, Calabar, Professor Angela Yoita, in her remarks noted that the organization, which is dedicated to making up-to-date information about the effect of healthcare intervention by preparing, maintaining, and disseminating systemic reviews of healthcare interventions, harps on the need for preventive measures using wash, water, and vaccination.
Every healthcare intervention is meant to do good. So Cochrane Nigeria tries to look at what the benefits are in the interventions that we are using in healthcare. And today we are here particularly to look at what findings we have on cholera and the need for us to have that protection. In case we step out of our environment, in case we come in contact with some other persons that have these diseases, we can stay protected. That's the essence of vaccine. It's secondary, yes, but it goes a long way in ensuring that our safe haven that we found ourselves is protected even when we move out of the area of safety.
Giving an overview of cholera, a public health physician, Dr. Ekongudo and Dr. Eperenen Esu, on frequent cholera epidemics, can vaccines help? Explained that vaccines represent an essential line of defense in controlling cholera epidemic. They noted that cholera prevails commonly in countries with fragile health systems and poor sanitation and remain endemic in several regions.
Fluid replacement is the primary goal in the management of people that are stooling and losing fluid, because the diarrhea in cholera is usually very profuse and it's a matter of minutes. So diarrhea can set in, cholera can set in at any time. And also in areas where we're having episodes of cholera. We've had reports, Cross River States have had reports of cholera in time past and more recently from the books. So moms should have this so that once the child is suspected to have cholera or begins to stool and begins to vomit, before you rush to the hospital, there's something you can do at home, which is to constitute ORS, give to that child. And even for the adults that can take fluid, that should be given.
The WHO developed a position paper on cholera and has recommended the oral cholera vaccine as an additional public health tool. So this underscores what Professor Yoita was saying. It replaces wash. So the vaccine is recommended as an additional. So the underlying understanding is that you would have invested first in improving water, sanitation and hygiene, and only provide this intervention as an additional public health tool.
Sunday Ena, Service News.